Hello and welcome to this training video on eating disorders. I'm Mark Brennan, Project Director for Continuing Education Television at the Missouri Institute of Mental Health, Continuing Education Division in St. Louis, Missouri. With me today is Dr. Randy Flannery, who is a clinical psychologist who practices out of St. Louis Behavioral Medicine Institute. He's been 20 years in the field working with eating disorders, so we could consider him an eating disorder specialist. He is also Associate Professor of Community and Family Medicine at St. Louis University here in St. Louis, Missouri. Welcome.
Glad to be here.
A lot of people in the audience, and myself included, are very interested in this topic of eating disorders. And you're going to be helping us today understand some of the basics of eating disorders. And I guess the first place to start is basically talking about some of the basic features of eating disorders. Can you help us to understand that?
Sure. Well, it's a combination of things. So there has to be disordered behavior around eating, which is either not eating very much at all, or in some cases excessive eating followed by purging, which is an effort to try and get rid of the calories. There are also cognitive components to it. So, for example, the person might have an exaggerated emphasis on being seen as thin to fit in with cultural ideals of thinness. And then there's an emotional component which has to do with how the person feels about themselves, and partly that derives from whether they fit into this ideal that they're trying to reach.
When you had mentioned cognitive, you're talking about thoughts?
Yes, how they think about things. Often they have distorted perceptions about themselves or how other people see them, which is part of the eating disorder too.
I guess one of the things that I was thinking of when you had said that are TV movies that I've seen, which generally depict an individual looking into a mirror, and it's usually a female, and she's seeing something quite different than what we're seeing.
Right.
And I imagine that has a lot to do with this idea of perception.
Yes. This is one of the parts that's probably hardest for people who don't have an eating disorder to understand. To the observer, objective observer like you and I, they look at this person, they see a very thin, perhaps even extremely emaciated individual, but the person themselves perceives themselves as being heavy, obese, or in immediate danger of becoming obese. And so you have this big discrepancy between how the person sees themselves and how other people see them.
That's an amazing thing. I wonder how people get to that point of not being able to actually see what everybody else sees.
This is one of the things that we observe. We know it's there, but how to explain it can sometimes be very difficult for us. So it's kind of like, well, can't you, like, look in the mirror, can't you see?
Exactly.
And yet the perception is so deep in terms of the person's view of themselves that those kinds of things just have no impact at all.
Oh, my goodness. How many types of disorders are there, eating disorders?
Well, in our diagnostic and statistical manual right now, there are two primary eating disorders. Anorexia nervosa and bulimia nervosa. Now there's a third disorder that is at this point considered tentative, but as they're revising our diagnostic manual, they may include that, and it's called binge eating disorder.
Binge eating disorder. So anorexia nervosa, bulimia nervosa, and binge eating disorder.
Yes.
Okay. What is binge eating disorder, by the way?
That is characterized by binge eating. And we have a pretty specific definition of binge eating, which is it's an excessive quantity, more than most people would eat in that particular situation, and it feels out of control. They can't stop themselves from doing it. If both of those are true, we would say that person is binging. And so with binge eating disorder, that's kind of the hallmark feature of it. That also characterizes bulimia nervosa. Binge eating is an essential element of that. The difference is that with bulimia nervosa, there has to be some kind of compensatory behavior for the excessive eating. So making oneself throw up, abusing laxatives, exercise, things like that.
Oh, so the binge eater does not compensate?
Does not do that. They typically binge and then may have erratic eating patterns, may eat excessively in response to stress or emotional events. But they don't have the compensatory behavior.
Do they feel any kind of guilt or
Oftentimes, yes, they're kind of mortified that they are eating in this way, perceive the binge eating as showing some failing on their part, and so will feel very bad about it. Tend to be kind of secretive about it.
They're not compelled to do anything about that.
Right.
Why don't we talk a little bit about obesity as an eating disorder?
Well, technically, obesity is not an eating disorder.
Okay.
Sometimes people think that it is. Obesity is really technically a medical term to describe someone's weight in relation to some kind of standard, some kind of norms. Many people, kind of the general public, may think that you're obese because you've got some kind of psychological problem, and often we're very negative in our judgments about someone who is obese. But the truth is that there are many reasons why you would be overweight, and it doesn't necessarily mean that you have an eating disorder. And so you won't find obesity as a disorder in the psychiatric manuals.
Oh, okay. That kind of makes sense since you've described it that way. I think a lot of times in our society in particular, we do tend to focus on image and outward appearance. And I would see that people would sometimes think that if that appearance doesn't fit the norm, that there must be some kind of problem or something wrong.
Right. We get very negative in terms of our judgments about people who are obese, and tend to use very pejorative terms to describe them. They're sloppy, they don't care about themselves, they don't have self-control, and even very young children adopt that view about kids who are obese, don't want to play with them, and really has devastating psychological effects on some kids. And so that's a problem, and that contributes to this whole eating disorder thing. That if you're growing up and you want to be accepted and you want to be liked by your peers, well, obviously you better not be fat because that's going to be a big turn-off to them.
Sure.
So that really contributes to the development of eating disorders.
Well, how do you treat eating disorders?
Well, basically there are three components to it. One is you have to assess their medical status, and if they have a medical problem as a result of their eating disorder behavior, to address that and treat that. So one part is kind of the medical assessment and management.
Okay.
The second part is dealing with the eating behavior directly, and this means establishing a healthy eating pattern, all the food groups represented, adequate quantity, that kind of thing. The third part is the whole range of psychosocial treatments, therapy, family therapy, identifying cognitive distortions and trying to change those, helping the person learn to cope better with different situations that come up, people in their lives, things like that. That last part is about 80% of treatment, but it's not very effective if you don't have the first two parts. So the first two part is a kind of a percentage of treatment is not very high, but it's absolutely essential to be able to be successful in the third component.
Could you give me an example of a cognitive distortion, since you had mentioned it?
Okay. We say a distortion is one in which the person has a deeply held belief, but the evidence supporting it really isn't there. All right.
Okay.
So with some of our eating disorders patients, they may see themselves as terribly unsuccessful in their lives. I'm a failure as a human being. Okay. Well, as you get to talk with them, you learn that they have a 4.0 grade point average. They're the captain of their basketball team. They got a scholarship to some prestigious university. So on the one hand, you have evidence that they're actually quite successful.
Sure.
On the other hand, they perceive themselves as being somehow inadequate and failing.
It's got to be very uncomfortable for the individual feeling that.
Right. Well, it's an interesting situation that their feelings about themselves are so at odds with what we would consider to be really more reasonable conclusions. And it can be very difficult to get the person to see this other evidence and incorporate that into themselves. So
it takes a while to...
Unfortunately, that's one of the things that's frustrating about treating people with eating disorders, are that it usually takes a while. We ask people when they start treatment to be thinking about this as a commitment over at least a year period of time. So what usually happens is that you start working with someone, they show some progress, they have slips, they may show some more progress, they may have a full-blown relapse, then they're turned off on treatment, and then they go away, they might come back. So that process is really an ongoing one with lots of stops and starts.
So tell us a little bit about what the prognosis is for people who have eating disorders.
This is actually kind of a complicated answer I'm going to give you here. You'd think it'd be kind of simple, but it depends partly on how long after treatment you're looking.
Mm-hmm.
All right? So if you look at like within a few years after the beginning of treatment, probably about 40% we would say are, quote, recovered.
Okay.
That is, healthy weight, not engaged in some of these harmful behaviors, have made progress in how they feel about themselves, carrying on in their lives in a reasonably effective way. About a third or so would still have symptoms, would still be having difficulties, but clearly better than they had been when they started.
Mm-hmm.
Then there's about 20% or so who are really not a lot better. They continue to have serious problems, and so we'd say they're not really improved and are looking more chronic.
Mm-hmm.
And there's a certain percentage who will die.
Oh,
so
my
like
goodness.
in the first 5 years after diagnosis, typically around 1% are likely to have died either from suicide or from the medical complications.
I was going to ask you that. So that
Yeah.
1% of individuals die. So you can die
Within
from
the 5 years, you most definitely can. And actually, anorexia nervosa, particularly, is one of the most lethal psychiatric disorders that we have.
Mm-hmm. Those are the disorders that are usually depicted on television?
Right. Anorexia is probably the one that most people are familiar with, the very thin,
Mm-hmm.
best little girl in the whole world kind
Sure,
of thing.
sure. How can you tell if somebody has an eating disorder?
For the most part, you can't tell just by looking at them.
Mm-hmm.
Often the disordered behavior and the attitudes are not obvious to most people who would be around that person.
Mm-hmm.
Quite often, you have to rely on what the person is telling you. So, except once they've advanced pretty far in the disorder, and they're very thin, you probably wouldn't be able to know just by looking at them. But what might tell you is some kind of odd patterns of behavior around eating. For example, not eating, you might know this only over a period of time, but everybody else goes out and eats, but it turns out that this person always has something else to do when the group is going to go to Pizza Hut.
Mm-hmm. Okay.
And so there's kind of a systematic avoidance of situations where everybody else might be eating. Or they're interrupting their meal to, go to the bathroom frequently during the meal.
Mm-hmm.
But probably what would be more evident to friends and family would be how the person talks about eating and their appearance. So if it's very negative, they make statements that they see themselves as obese when really they're not, that would probably be the clearest indication.
Do people who have eating disorders also talk about a repulsion to food, or?
Well, there's a lot of varieties with eating disorders. Many people say, I really like food, but I can't let myself do it because of the effect that it's going to have on me.
Mm-hmm.
Very few actually say that they are repulsed by food.
Mm-hmm.
They might say they're not hungry, or it's not appealing, or there are reasons why they shouldn't eat that. But it's relatively rare that there's that kind of aversion.
So what would I do if I knew someone who had an eating disorder?
Well, the first thing I think you would want to do, if you're talking as a friend or a peer or a coworker, would be to talk to the person privately, saying, "This is what I observe. This is what I'm concerned about,"
Mm-hmm.
and try and check it out with them. So
Okay.
it's non-judgmental. It's really kind of coming from a position of caring and concern and wanting to see that things are okay or not. Sometimes the person will say, well, I am struggling with this. Sometimes they're likely saying, no, what's the matter with you? I don't
Sure.
have any problem. In that case, suggest kind of watching the situation, and if you get additional evidence that there's a problem, again, come back to the person and say, I know I talked to you a couple months ago about this.
Mm-hmm.
I'm still concerned about that. And you might suggest at that point talking to a specialist or perhaps going to their doctor to get it checked out, because there might be signs of a problem of an eating disorder that would need to be addressed. As a professional, let's say someone comes into treatment and what they're telling you is they're very depressed or they're anxious. All right. In the course of your working with them, you may learn from what they tell you that actually they have major preoccupations about how they look, and then you would want to follow up. Well, what are you doing to try and change how your appearance is if you don't like it. Okay, and sometimes then they would begin to acknowledge eating disorder behavior, and so you might then at that point later on get evidence that they have an eating disorder.
Do people who have eating disorders ever recover?
Yes, yes. I was telling you before about kind of the short term, that the recovery is only about 40%. If you follow people over an extended period of time, like after 10 years, there's good news and bad news. The good news is that after 10 years, probably 3/4 we would consider recovered. Unfortunately, the number of people who have died also goes up, so it's about 10% or higher after 10 years. And then there's that unfortunate 20% or so who seem to be kind of locked into their eating disorder, constantly dealing with this, may continue to show a lot of these behaviors in and out of the hospital, in and out of treatment without really making lasting change.
So what do people need to recover from an eating disorder?
Well, one, the very first thing, and sometimes this is the easiest part, is to stop the harmful behavior. So for someone who's very thin, who has anorexia nervosa, one of the first goals is to begin to eat adequately and restore one's weight to a healthy weight range. If you do harmful purging activities, self-induced vomiting, laxatives, diuretics, all those things, to stop that, to discontinue that. Now, once you change the behavior, that's like one of the first steps. Then you have to begin to address how the person sees themselves, some of these perceptual distortions, the judgments the person makes about themselves, and to try and reevaluate and adopt healthier ways of thinking about oneself and dealing with other people. Then you move on to how dealing with regulating emotions. Right? Sometimes they can be extreme and difficult to manage by the individual, so to develop skills to help manage those kinds of situations.
And is eating disorders, has that always been a part of our society, or is this a 20th century phenomenon? Have we always had eating disorders?
The clinical definition of anorexia nervosa, as we understand it today, was described back in the 1850s. So it's really been around a long time, but it was considered very infrequent until the last 30 or 40 years. Bulimia nervosa, as we describe it now, was really only first described in the last 25 years, but its prevalence has just dramatically increased over that period of time. So it is a modern phenomenon in the sense that we see it in the last couple hundred years of our history. But something has happened from the mid-century on that really has increased the prevalence of this, and we think that does have to do with social and cultural changes that have occurred.
In summary, are there some basic points that you would like to recount for us about eating disorders that we should remember?
I guess one thing is that it is a very serious condition, and that if you have some hint of it, it's really worth pursuing because the health risks are so severe. The second thing is while it's challenging and can take time to recover, I don't think people should be discouraged because people do indeed recover and their lives are much better if they do.
Well, it's a very interesting topic to be considering. I know that there's probably other material out there that we can all get our hands on that would help us to understand eating disorders more specifically. I would encourage all of the people who are looking at this film to review the key concepts and also the glossary of terms, and if you do that, you'll have no problem completing the test. Thank you, Dr. Flannery, and thank you and good luck.